To begin the cranial nerve assessment, we'll start with cranial nerve 2, the optic nerve. In normal circumstances, I have the patient stand 20 feet away from the Snellen chart to assess for visual acuity. I have the patient occlude one eye at a time, read down the list until she can read the smallest line she's able to. For the purposes of this exam, we'll assume she has 20/20 vision, which would be a normal finding, meaning she could read line 8 on both sides of the eye. We also want to assess for confrontation. So I'll have the patient occlude one eye at a time, and then I want to stand face to face to her at eye level, and we should both be seeing my hand in the peripheral vision at the same time. Ready? Let me know when you see it.
Yep.
So I want to do this on both sides, having her note when my hand comes into the peripheral vision. And then to assess for cranial nerve 3, which is oculomotor nerve, we want to assess cranial nerve 2 and 3 simultaneously with pupillary response. So people should be round, equal bilaterally, and reactive to light. So I'm going to shine the light into each eye, and the pupil should constrict with light and dilate as the light moves away. We also want to assess for consensual light response, which is when I shine the light into one eye, the opposite eye should also constrict. We also want to assess for near response, so if she focuses on my pen light and then an object that's distant, like the lamp behind us, when she focuses on my pen light, her pupil should constrict, and when she focuses on the lamp behind me, her eye should dilate, and that is a normal finding. To assess for cranial nerve 3, 4, and 6, which in this order is oculomotor, trochlear, and abducen nerves, we want to assess for extraocular eye movements. So I'll have the patient follow my pen light, and I would move much more slow, but we're going to go up and down, to the left and to the right, and then diagonally up to the left, down to the right, and then back that way. And our eyes should be moving smooth, symmetrically, with no signs of nystagmus, the involuntary eye movements, or ptosis, the drooping of the eyelid. Those would be abnormal findings. We also want to assess for convergence, so I'll have her follow the tip of my pen light, moving it towards her. Her eye should have full convergence with no signs of nystagmus again, or ptosis, and her pupil should constrict at the same time, which is a normal finding. For cranial nerve 5, which is the trigeminal nerve, we want to assess for her temporal and masseter muscles. So I'll palpate them while she clenches her jaw, and there should be equal strength on both sides. It should move symmetrically. I'll have her open her jaw, move it side to side, again with symmetrical movement, to assess the motor portion of trigeminal nerve. To assess the sensory portion, I'll have her note if it's a sharp or dull touch in the 3 areas of the ophthalmic, maxillary, and mandible regions. So let me know if you feel a dull or sharp touch. Close your eyes.
Dull, sharp.
And I would do the same thing on the other side. And a normal finding would be sensation in being able to note a dull or sharp touch in all 3 of these areas. For cranial nerve 7, which is the facial nerve, I'll have the patient make a series of facial expressions like raise your eyebrows, frown, show me your teeth, smile, puff out your cheeks, and then close your eyes tightly and open them. And we want to note symmetrical facial movement, no signs of weakness or drooping on either side, and this would be a normal finding as well. For cranial nerve 8, which is the acoustic or vestibulocochlear nerve, I'd have the patient spin around, occlude one ear at a time. I'm going to whisper a phrase behind her and have her repeat it back to me. 8.
8.
Assuming that she can do this on both ears, that'd be a normal finding. If she was incorrect, then we move on to the Rhine or Weber test to assess for hearing loss. To assess for cranial nerve 9 and 10, which is the glossopharyngeal and vagus nerve in that order, I'll have the patient open her mouth and say, ah.
Ah.
And I'm looking for the soft palate, uvula, and anterior posterior pillars of the pharynx to rise symmetrically. So the soft palate should rise symmetrically, and the uvula should remain in midline with no deviation to the left or right. That would be an abnormal finding. And then I also want to note in her voice any signs of hoarseness or nasal quality, and that would be an abnormal finding as well. And then I'll have the patient open her mouth to assess for the gag reflex, lightly stimulating the throat on each side for the gag reflex for cranial nerve 10. For cranial nerve 11, it's the spinal accessory. I'll have note the trapezius muscles of her neck and shoulders, noting any signs of atrophy or fasciculations. I'll have the patient shrug her shoulders with resistance, noting equal strength on both sides as a normal finding. I also want the patient turn her head to the left and the right with applying resistance, and I want to note the engagement of the sternocleidomastoid muscles, and it should be equal strength on both sides. And then cranial nerve 12 is the hypoglossal nerve, and I'll have the patient protrude her tongue straight out. It should be midline, have it move it side to side. It should be symmetrical movement on both sides as a normal finding. No signs of atrophy or fasciculation.